Here are some of the main causes of male infertility. Varicoceles. The leading cause of male infertility is varicocele, which is the swelling of the veins that supply the testes. 4. This is similar to how varicose veins become swollen due to an increase in blood pressure. This causes poor sperm quality, motility, and function. In many cases, they are treatable. Certain medications. Some medications can impair your ability to produce healthy sperm or negatively affect sexual function. Anabolic steroids, taken to increase muscle mass, can disrupt your body's natural testosterone production, which is a crucial hormone for sperm production. Studies also show that some medications taken to combat depression and anxiety can affect sexual function, including a lowered sex drive, erectile dysfunction, and delayed ejaculation. Other FDA-approved medications that can affect male fertility are certain antibiotics, Ketoconazole, specifically, as well as some medications to treat blood pressure or autoimmune disorders. If you're seeing a fertility specialist, bring along any medication you are taking or have recently taken to your appointment, regardless of whether or not it is over-the-counter or prescribed. Kallmann syndrome. Kallmann syndrome is a rare disorder that causes the delay, and sometimes prevents the completion, of puberty. A key characteristic of Kallmann syndrome is an impaired sense of smell. It can affect both males and females but is more common among males. For males, other symptoms include undescended testicles and the inability to grow facial hair. Without hormonal treatment, people with this syndrome will be unable to conceive. Low testosterone levels. Testosterone is a male sex hormone that is responsible for sperm production. Low testosterone levels can reduce sperm quantity and impair sexual function, including lowering your libido and causing erectile dysfunction. As such, low testosterone levels can signal difficulty with conception. Age-related sperm motility. While males can technically get someone pregnant at any age after puberty, male fertility does decline with age. Studies show that sperm quality, concentration, and motility are all affected by advanced paternal age, which is widely considered to be age 40 and over. Environmental toxins. Sperm levels are declining globally, along with sperm quality. While scientists debate the cause of this alarming trend, studies show that exposure to environmental toxins, such as pesticides, plasticizers, a substance found in most plastics, and radiation from electronic devices, can negatively impact male fertility. The toxins disrupt the delicate hormonal balance required for healthy sperm production. Retrograde ejaculation. For people with retrograde ejaculation, some or all of the semen released at the point of orgasm passes into the bladder instead of through the urethra and out of the tip of the penis. Cloudy urine after sex is a common symptom associated with this condition. COVID-19. There is no evidence to suggest that vaccinations against COVID-19 can impair male or female fertility. However, scientists are exploring a link between male infertility and actually contracting the virus. A study published in Fertility and Sterility featured 120 Belgian men with a median age of 35. It found that 60% of participants had reduced sperm count and motility 1 month after testing positive for COVID-19 to 37% were still impacted 2 months later. Exposure to high temperatures. A study from 2018 found that infertility levels were high among male bakers due to the hot environment they work in. This supports evidence that anything that raises the temperature of the testicles can reduce the quality of sperm. Tight underwear, a laptop placed over the groin for long periods of time, and undetected varicocele, or even just frequent trips to the sauna or steam room can all drive the temperature of the testes up. Stress. Studies show that psychological stress in males is associated with both poorer sperm quality and lower concentrations. When a person is stressed, they release steroid hormones called glucocorticoids which suppress testosterone levels. In addition to poor sperm quality, stress can also negatively affect sexual function. Certain STDs. Chlamydia, one of the most common sexually transmitted diseases in the US, has been shown to reduce male fertility when undiagnosed. Approximately 50% of men with chlamydia don't experience symptoms. Until treated, the infection can cause significant sperm DNA damage. Other sexually transmitted diseases, including human papillomavirus, HPV, and hepatitis B and C viruses, are also associated with poor sperm quality. Attending regular screening for sexually transmitted diseases can help avoid this. Immunologic infertility. Both males and females can suffer from immunologic infertility. In men, it is an autoimmune disease that prompts the production of anti-sperm antibodies, ASAs, against their own sperm. These antibodies hinder sperm count, motility, and viability.